Hey, future medics, it's me, Tina, your medic mentor, and today we are talking about one of the strongest pain medicines that we carry in the field. It's fentanyl, and the brand name is Sublamaze. Now, I know what you're going to say. Probably what every patient says to me now. Isn't that going to kill me? Isn't that what was on the news, killing all of those people? I'm going to tell you, like I tell all my patients. Anything made in a car battery is indeed bad for you. Indeed, it is. What I carry was made in a laboratory under controlled conditions by scientists, and I'm going to dose it by your exact weight, making it tailored for you specifically, which is much safer. Okay? So now that you're ready, let's get into the rest of it. Fentanyl is a synthetic opioid analgesic. This one is going to bind to your opioid receptors in your brain and your spinal cord, just like we saw with morphine. The difference is it's 50 to 100 times stronger than morphine. So much so that we do not give this in milligrams, we give this in micrograms. So I absolutely do understand anyone being scared of it. It's a very strong medication. But we'll see in the dosing that we actually give a much smaller amount than we would give of morphine. In EMS, we use fentanyl for severe pain, so pain that we get with trauma or burns. It's wonderful to get the pain relief without the sedation effects or the blood pressure problems that we can see from morphine. The dose is 1 to 2 micrograms per kilogram. mcg is microgram. Micro, small, tiny, okay, per kilogram. And this is given IV, IO, IM, and even IN, intranasally. Now, I was just stressing to you the importance that this one is in micrograms. And I want to tell you another shorthand that we use on the rig because things be moving quickly on the ambulance. So, of course, we have a shorthand for everything. You will often hear this called mics. Micrograms, mics. So I might tell you like, hey, I've pulled up 50 mics for this patient, 75 mics for this patient. Just so you know what it is when you hear it, mics is micrograms and migs was the milligram. It goes off of the shorthand for the label. MCG, mics, MG, migs. You got it. You get it. The onset for this one is quick, especially if you have an IV. It's like 1 to 2 minutes. 1 to 2 minutes, and they're already feeling relief. Fantastic. It lasts about 30 to 60 minutes. It's a great medication. Now for the safety side, the side effects. Fentanyl can cause respiratory depression, just like we saw with morphine. Same kind of medication, right? So it does same kind of things. So keep an eye on your patient and make sure their breathing is adequate. Okay? Can also cause hypotension and bradycardia. If you push it too fast, it causes chest wall rigidity. This is a slow IV push. Do not slam this medication. You'll have all kinds of problems. Contraindications include known hypersensitivity, hypotension, and CNS depression. Now, just like we saw with morphine, Narcan can also reverse, there we go, fentanyl. Sometimes we don't know how people are going to react to medications until we give them. Some people are very sensitive to opioids. Some people are not. Some people might be taking other medications that will potentiate the effects of an opioid that we give them. You might not be aware of that until you push this medication, and they're a little more sedated than you wanted them to be. Narcan can help with that. Also, our older patients tend to be more sensitive to these medications, so you might think about giving them a half dose or a smaller dose first, and see how it sits with them because we can always add more later if it wasn't enough. It's a little bit safer that way. Food for thought for your practice. Here's your takeaway. Fentanyl is fast. It is clean, made in a laboratory, you remember, and it's strong, but it does demand your respect. Keep an eye on your patient. Keep an eye on their vitals and their respiratory rate, and titrate to effect. We don't always know how it's going to go until we try it. Be safe. You're doing such a great job going through these drug cards. I'll see you for the next one.